Good morning, Trinidad and Tobago. Welcome to the premiere episode of Ask Dr. Antoine. So if anything is bothering you medically, if you have any questions, what you have to do, ask Dr. Antoine. But this is not about me. This is about healthcare, improving healthcare in Trinidad and Tobago and across the Caribbean. And again, welcome to the premiere episode of Ask Dr. Antoine. We're here this morning to celebrate Dr. Marsha Lee George, a sister of the soil from Trinidad and Tobago, which currently practices in the United States of America. She is a nurse practitioner, the only nurse practitioner who will be the first to be licensed in Trinidad and Tobago. Dr. Marsha Lee George is the clinical director of the Stroke and Diabetes Center located at Piarco Plaza in Trinidad and Tobago. So Dr. George, welcome home.
Thank you. It's great to be home.
Well, that's good.
It's so nice to be home.
So now this is just lineman. We just lineman with Dr. George. We're having a medical line today, and we're gonna keep it real. We're here to bring you facts, figures, everything. So this morning we're here to, Dr. George just published a book with Dr. Kimlin Ashing out of City of Hope of California. She's a psychologist and Dr. George is a nurse practitioner. Dr. George is a nurse, doctor, books writing, the whole works. And she truly is one of Trinidad and Tobago's elite academically, with lots of ideas. And you know, a lot of your ideas have cost me money, right?
Yes.
Yes, but I like that she brings out the ideas. So Dr. George just published Detecting and Living with Breast Cancer for Dummies, published by Wiley Publishers,
yes.
right? So Dr. George, how does it feel to be back home?
It's great. And the more I spend time here, I realize there's so much work for us to do. There's so much we can do to help our country under healthcare, especially cancer. You know, like cancer is like an epidemic. People dropping like flies in Trinidad. It's unbelievable. You know, when we think of breast cancer, prostate cancer, and colon cancer, it's just astronomically high. And what's sad about it, a lot of it, we can prevent it. A lot of it, we can educate, we can do lifestyle changes, we can be more informed and hold our medical professionals accountable. But the only way we can do that, we gotta educate the public and we gotta re-educate medical professionals as well.
Now, Dr. George, I do a lot of community outreach programs. And it's not that I do it, my team does it at the Stroke and Diabetes Center at Piarco Plaza.
Yes.
So we go out to churches and communities, and I'll tell you, this is funny. Young women out there, 40 years old, in Trinidad and Tobago, and I go out to some rural community, and I say, hey, when is the last time you had a pap smear? She says, this young woman in Grand, she says, Dr. Antoine, you know what it is to do with pap smears? I said, of course I know what it is. She said, my husband don't like that. Now, how do you educate a 40-year-old woman who's had 3-4 kids to have a pap smear, do a breast exam? There's so many people who don't know how to do a breast exam. I'm really good at drawing the pictures now, right?
Yes.
Since medical school, I've drawn these pictures and I show them how to do a breast exam and how to do it correct. How do you go about educating us? Because you know, Dr. George, our people are dying and we're here to end that. So how do you educate these young women, these young men about cancer and doing the screening tests and educating young doctors? They have to educate people to do these tests. How do you go about doing it?
Well, first of all, you know, a lot of the medical doctors, they're uncomfortable examining a woman's breast. You know, a lot of primary care or general practitioners would do a physical exam without touching the woman's breast. So we have to break that barrier.
Is that a physical exam? That's like you can do that on the phone then.
But a complete annual physical exam do include a breast exam. It does include a digital rectal exam. And if your general practitioner is not